Hello, everyone. Welcome to the next episode. Today, we have a very special episode, and our guest is Dr. Ameerah Wahedally from Germany, and she's in the city of Bad Mergentheim. Hello, Ameerah. Welcome to the show.
Hello, thanks for having me over.
Yeah, it's a pleasure to have Dr. Wahedally in the show. And she is originally from Mauritius. And around 2 years ago, she came to Germany and she went through all the process of getting the license. And we all know that for the doctors from abroad, it's a really tough process to get into the system. And she went through that very well. We will talk about her experiences in Germany, how were her experiences in the start in a new country, and also uh, um, she just she is now working in the field of orthopedics, and we will talk about that. And also she had some experiences with COVID-19. She was also infected with that, but luckily she is very well now. So we'll talk all about it. So Ameerah, welcome to the show and tell us about your experiences while coming to Germany. Why did you choose Germany and why did you come to Germany in the first place?
Yeah, first of all, thank you for having me on your show today. I came to Germany in 2019. A friend of mine works at the hospital in Schwäbisch Hall, and she organized a hospitation, which is an internship at the hospital. And then I came for this internship, and while doing my internship, I studied for the B2 German level at the Volkshochschule, which is where a school where you can study languages. And once I was done with my internship and my B2 courses, then I applied at the medical council for my license.
Good. So it means that you already did German level B1 before coming to Germany, right?
Yes, yes, I did this before, yes.
Mhm. For the viewers, I will tell you that Dr. Ameerah Wahedally can also understand Urdu language, Hindi language. So that is also very interesting. And I am sure many of the viewers will also not know that where on earth is Mauritius. Yeah. So Mauritius is a country next to Africa, but in the middle of the waters, you know. She has been traveling across many countries. She did her higher education from Hungary and Serbia, and then she came to Germany. So, what were the challenges first when you came to Germany with the culture and everything, adjusting in the new place?
Uh, I I am versatile with languages, but German for me was hard at the beginning.
Mhm.
Um, I mean, when I came, I could understand German, but I was not willing to talk because I'm a perfectionist. I felt that my German was not good enough for me to have a
Mhm.
conversation. Uh, then when I started talking, and then people encouraged me saying that I speak good German, I was now when I speak to my patients, they were like, "How long have you been in Germany? You speak very well." I was like, "But
Okay.
deep inside, I feel like I'm not fluent yet because it's
Mhm.
quite a hard language, and you also have the same experiences. It's not an easy language, and so French also is not easy, being my
Mhm.
mother tongue. But now I would say it's quite good. I mean, I am adapting to the medical system here, which I find very good, and
Mhm.
like the transit, the fact that I have been in Europe and studying in Europe and to transfer here in Germany was not such a big transition.
Mhm.
Just the language for me was at the
Okay.
beginning a barrier, but now I
Mhm.
would say I have been able to tackle this issue. And also, if I could, like on the whole, I would say I have had positive experiences.
So that's really
Like
good to hear. Mhm.
yeah,
So
like
you know this.
recently I had a bike as a birthday gift, and I was on the like in front of the garage and repairing it and building it up. And then everyone under my street was like, "What are you doing?" And then they brought tools. They helped me to put the wheels and the pedals, and I didn't know them, but they were my neighbors. And I
Yeah.
was very impressed by these gestures,
Mhm.
and I really appreciate it. Like, but these are things that would have happened back home in Mauritius, but here I am, a foreigner living here in Germany. But it was a very nice experience.
Mhm. So it means that your experience coming into the new country was very well, and till now you are very happy. So many doctors ask me about what are the process to getting registered as a doctor in Germany. For example, I belong to IT field. For IT, it's easy. You go in any country, you need to know the programming or something, you can work. But for doctors, every country has a different licensing procedure or accreditation procedure. So but you were in Europe, you did MD, but in Pakistan and India, it's MBBS. It's slightly different. So, what are the first steps when you come to Germany? You have to minimum level of language you needed was B2 or C1. What level of language was required?
Okay, you need to have your minimum, which is the B2. Then you can send all of your papers to the medical council, and also you need to have medical C1 to do the medical license exam,
Okay.
which is the Fachschaftsprüfung, which my other colleagues will know about.
Hmm.
And you can also go to the Regierung Präsidium website and find out all the other informations needed, because they keep updating every year, like new
Mm.
papers are needed and so on.
Hmm. Okay. So, so for my viewers, it might be interesting that you also understand Urdu language. So, can you explain this relationship with Urdu language? How come you learn or you know about Urdu language? And you were telling about that your father was also a Urdu language teacher in Mauritius, which is very far away from Pakistan or India. So, please share some experience about Urdu language.
Okay, those who studied at home in Mauritius, we had to take an Oriental language, if I can say it like this. So for me, it was like studying Urdu, but I was not very keen at the beginning, so that I had to do it, not because I wanted to do it. Then I had to
Mm-hmm.
study it for 6 years, and my other classmates studied Mandarin, others Hindi, and Tamil. Yeah. But now, I have been to Pakistan twice, and then I still have some cousins there and relatives there. I mean, I would say I can watch a Hindi movie without subtitle, and I can understand maybe 80%
Okay,
of it.
interesting. Mhm.
So I think I'm getting better every time.
That's very nice. That's very interesting. Uh, So tell us about this experience. So you told me that you had an experience with COVID-19. So we all are afraid and in the lockdown at home, but the doctors cannot escape. They have to be in the hospitals. And so how was your experience how was your reaction when COVID first came into Germany? And how were the first reactions for you and for the doctors around? And how did you got infected with COVID?
Uh, like yeah, when this pandemic started, we were all like, oh, like we will be the frontliners, and one day or the other, somehow we will be affected being a frontliner.
Hmm.
And obviously, I caught it at my place of work, and when I was tested positive that day, it was a shock. I might be a
Hmm.
doctor, but I'm still human. It was a
Hmm.
shock, so I tried to co- compartmentalize this issue for that day. I was like, my boss asked me to discharge as many patients as I could, and before we're going to quarantine.
Hmm.
And that day, I remember I finished like 9 p.m. with all my work, and so that my other colleagues could take over after I'm gone. My symptoms started like cold-like symptoms. I had it felt like some kind of flu. I had
Hmm.
joint pains, and but the headaches were horrible, like
Okay.
horrible. Like it was difficult to concentrate. And once I was in quarantine, the symptoms developed further.
Hmm.
Uh, but I didn't have fever. I was not able to breathe one night. I really felt like very bad that night,
Hmm.
and I couldn't feel my legs. I couldn't walk. I was too weak,
So
and
it is very painful experience also. There is a lot of pain also involved, or what is the
yeah,
experience?
lots of pain in the joints. For me, especially where in my pain was in my elbow, in my elbows, and what else? I lost the taste, the sense of taste. Like when I was eating, I couldn't taste it. It was not a very good experience. But now, after so many weeks, still like to get the taste of salt, it's still a bit hard. And during this painful experience, like I had the support of family and friends, and like who were like always like checking if I'm still alive,
Yes,
still
this I
like
wanted
I'm
to ask about
awake.
the emotional experience, that emotional
Yeah, and
shock.
if I didn't have this support system and my belief in something bigger than myself, like I don't think I would have survived it like in a shorter period. Like
Mm,
in all together, it was about maybe 3 weeks. But I'm very grateful for my friends and family who were there for me all the time. Like my dad is a very busy person, but when I got tested positive, he called me several times a day,
mm,
and like this showed that he really cared. He showed,
mm,
which
mm,
was a nice, like the positive thing of this
mm,
experience.
mm.
And like my friends who were like monitoring me from all from different corners of the world, telling me like, yeah, temperature, what are your symptoms today, like what did you eat, what, yeah.
Mm.
So very very painful experience, like being tested positive for COVID-19. But
Yes.
on the bright side, I got closer to my family, to my friends,
Mhm.
and I'm grateful for that.
Okay, that's good to hear that you are fully recovered now. But also tell us about the feelings during that time of uncertainty, because they were saying that there is no vaccine yet. So some people get well automatically with quarantine, or what are the measures that need to be taken if someone gets infected? How can he get well? Because at the moment there is no vaccination or no medicine to cure it, right?
Yeah, till now we don't have a vaccine. Like maybe what worked better for me was like I always drink warm water. I don't
Mhm.
drink anything cold, and a lot of tea. I have been drinking a lot of tea during that period, during the day, and
Mhm.
fresh ginger, like to keep your immune system stronger, and fluid, a lot of fluid.
Okay. So it's good that this phase was over and you're back, and now you're back also in the hospital dealing with patients. Everything is returned to normal, right?
At the moment, I have some couple of days off, some holidays, but I will be back to work after the 25th.
Okay. hmm So it's really good to see that you're back to normalcy, and this tough phase of COVID-19 is history now. But I really hope. So, do you want to give some precautionary tips to our viewers, like who are not taking it maybe seriously, or many people are serious but still they miss some precautionary measures because you went through this pain of being infected with coronavirus? Do you want to give some tips to the viewers?
Yeah, like we all know, like social distancing, maintain this and wear your mask, your gloves, and once if you go out to the supermarket, like always wear your mask and your gloves, and when you come home, like remove everything. Like first thing I always do, like wash my hands and for several
Mhm.
minutes, wash thoroughly, and drink a lot of fluids.
Okay, good tips. So now we will move back to the topic about discussing about your medical profession. Um,
Mhm.
so, what are the things that a foreign doctor, when coming to Germany, he should be careful or well prepared before coming to Germany, or he can start preparing when he thinks that he wants to come to Germany?
Like so for someone who hasn't lived in Europe before and coming to Germany might be a culture shock. Like
hmm
for someone coming from India or Pakistan, and people here don't wear several kameez, yeah. Uh, and the language, like if you can prepare for your German, like till the B2 level from home in
hmm
Pakistan itself, that would be a bonus for you. Like for me, I didn't have this opportunity to do B2 where I was studying. We had the course till B1, but even here, for me, it was better to study the B2 because you're in a German-speaking country. You have to speak German all
Mm-hmm.
around, so you will learn the language faster. Like when you're put in a difficult situation and all you have to do is use the language, then you will have to use it.
Mm-hmm. So these are very good tips for the doctors and actually for everyone for who wants to come to Germany. It's better to learn some basic language level before coming to Germany. So
Yeah, definitely.
we talked briefly with Dr. Wahedally about her experiences of coming to Germany. We talked about her experiences during COVID. We will little bit talk about also the being a woman and working alone in Germany and experiences to compare to Hungary and Serbia and maybe Mauritius. So you are missing your family also, but have you have some kind of problems working alone or you miss your family? Share some experiences because it's a foreign country, you know.
Like my experience right now at my work, I'm the only female doctor, and everyone around me they are male doctors, and I am small compared to them. They are very big, and one of them was like the shy doctor, which was funny. But has an experience on a whole, like being a doctor, whether you are a woman or not, like me personally, as being a woman and a doctor, it's to show confidence and to be good at what you do. Then
Mm-hmm.
people will respect you. Like when patients came to my room, at first they were like, "Are you the student?" And I was like, "Why?" Because you look so young, you can't be the doctor. I said, "No, I am the doctor." And then they started talking to me, and then when I start examining them, then you can see that yeah, I might be small, I might be a woman, but I know what I'm doing and I'm doing it right, and they are satisfied. Like
Mm-hmm.
when I admit them, that doesn't mean that they will be my patients after that. They will, it depends where they will stay in the hospital, like who will take over them. But when I see them afterwards in the hospital, they were like, and it's always nice to see you. I was like, why? Yeah, because you admitted us and then you're always smiling. So
Okay, good.
these are like good feedbacks. Like
Mm-hmm.
as a doctor, like when I see that they are happy to see me, then I was like, I'm doing something right.
Mm-hmm. These are also very nice, good tips for everyone. So even in the new place, just work hard and prove yourself that then people around you will appreciate you. So it was really a pleasure. So tell us something, some couple of words or sentences. Can you or some phrases in Urdu if you can remember? So we are testing you now for your Urdu language.
I uh, I don't know. I don't know. You have to talk to me, and then I can reply just like that's to say anything
आपका
in
आपका
Urdu.
क्या हाल है?
Uh, मैं ठीक हूँ और आप?
मैं भी ठीक हूँ। आपको उर्दू आती है थोड़ी बहुत?
या थोड़ी थोड़ी।
तो कोई मूवीज आपने देखी है? कोई मूवीज का नाम जो आप कह रही, मैं हिंदी मूवीज देखती हूँ, कोई फेवरेट मूवीज?
कर हो ना हो।
अच्छा, वेरी गुड, गुड। So you have passed your Urdu test. Good. So that's interesting. So people,
Yeah,
so for the people, it will be interesting. So in the in Africa, next to Africa, in the islands, there is an island called Mauritius, and there also some people are speaking Urdu language. So that's very interesting. So Dr. Ameerah Wahedally, we had a wonderful talk today. We discussed about several things about your experiences as a foreign doctor in Germany, also during your COVID, and as a strong lady working alone away from home and proving yourself as a good quality doctor here. So when I say that we are wrapping up the show and you have 2 minutes or 1 minute to give some good message to our viewers, what will you give?
I would say like to always be kind and to always approach someone with a smile.
Mhm.
And what other others think of you, like those who don't know you, it should not affect you. It shouldn't be none of your business. But you should know who you are, and
Mhm.
you should continue to be kind to other people. And whenever you can help, you should help.
Very nice message. Thank you very much with this nice message. we will end the show. And it was a pleasure to have you as our guest. And I'm sure all the viewers must have really enjoyed it. And those who will be watching the recording, please also give your feedback in your comments. And till next episode, goodbye. Thank you, Dr. Wahedally. It was a pleasure.
Thank you for having me over.
Thank you. Thank you. Thank you, all the viewers. Goodbye.
Bye.